Good afternoon. Since Friday, May the 22nd, we have seen a 9% increase in confirmed COVID-19 cases here in Baltimore City. As of this morning, the city has 4,888 reported cases, 368 people hospitalized with COVID-19, and 225 deaths. I'm up here as much as possible to ensure our residents have the most up-to-date and accurate information, so they in turn can make smart and informed decisions for themselves and their families. We remain focused on continuing to scale up our response to this emergency to ensure residents of our city have the resources and support they need at this time, while continuing to leverage the wealth of medical and public health expertise here in Baltimore City. I want to remind residents that they are encouraged to call their doctor or 211 for coronavirus symptom screening and to be connected to a physician for assessment. I also want to remind residents of the invaluable resources available at coronavirus.baltimorecity.gov. And now we have added a tab on the left menu for residents to find testing locations. I want to thank the majority of our residents who observed the holiday weekend responsibly, and to those that did not, I want to again stress that this pandemic is real and is here in Baltimore City. If we begin to relax our mitigating practice before we are ready, we will assuredly see another surge in confirmed cases. On Friday, Dr. Deborah Brooks, the White House Coronavirus Response Coordinator, said the #1 metro with the highest positivity rate is the District of Columbia, which includes Northern Virginia, and in Maryland, Montgomery County, and Prince George County, that is followed by Baltimore City. She continued, there is still significant virus circulating here. So I want to be clear that Baltimore City is still under local stay-at-home orders for Baltimore City. This means that all residents are required to remain at home unless they have to go out for an essential job or task. Please believe me, I would love nothing more than to be able to tell our residents that it's safe to resume businesses and other activities. But we're not there, and it would be irresponsible to do so. I know I probably sound like a broken record because I get tired of saying it, but it's that important. We need everyone to stay home unless you need to go out for an essential reason. If you must go out for an essential reason, everyone should be wearing a face covering. And again, I want to thank the majority of Baltimoreans who have heeded the warnings and followed the guidance. Now I will ask Baltimore City Health Commissioner Letitia Zavasa to update you on our COVID response and our work to support the residents of Baltimore City.
Thank you, Mayor Young, for your leadership during these difficult times. Today, after reviewing local COVID-19 data, we at the Baltimore City Health Department are cautiously optimistic that some key COVID-19 data trend lines are showing signs of changing in a positive direction. Over the past week, we saw a slight drop in the Baltimore City positivity rate from 21% to 17.5%. Our overall goal, based on World Health Organization guidelines, would be to reduce that positivity rate to under 10%, which can occur only with additional testing availability. As we announced last week, our partnership with the lab vendor Hologic, and in partnership with the Maryland Department of Health, the city is increasing the number of tests we now have available for residents. In the past 2 weeks, we have also increased our testing sites to include not only community-based testing at Pimlico, Druid Hill, and Clifton Park, but also mobile neighborhood testing sites, as well in the South Baltimore and Highlandtown areas of the city. I'm excited to announce that residents can now find a virtual and interactive map of the city-based testing sites on our website. This map includes mobile testing, medical center testing, and community testing tents. Again, you can find this map at coronavirus.baltimorecity.gov if you click on where to get tested for COVID-19 in Baltimore City. Just a reminder that our community-based testing sites still require an appointment and a referral. However, our mobile testing sites are first come, first serve. The locations of mobile testing sites are subject to change based on weather, community need, and testing availability. The COVID-19 data suggests we are beginning to move in the right direction locally in bringing the positivity rate down. However, we will continue to examine the data regularly and use it to drive our decisions around reopening. Though we may loosen restrictions, my message to Baltimore City residents remains the same. Please continue to abide by social distancing guidance, wash your hands frequently, and wear a cloth face covering when in public and in close proximity to others, such as in the grocery store or a pharmacy. Please answer the phone and answer the questions honestly if a health department contact tracer reaches out to you. If all Baltimore City residents continue to follow these guidelines, we will continue to see improvements in the data, allowing us to consider further reopenings of city services and businesses. Thank you.
Thank you, Dr. Zavasa. Today, I have a few announcements about Baltimore City's reopening. Understanding the importance of staying at home, we are making a few small exceptions because we believe they can be done safely if done properly. First, starting tomorrow, we will allow for curbside retail. We're implementing this to help our small retail businesses and allow residents to safely obtain goods. The Department of Transportation and the Parking Authority are launching retail parking zone program to make these curbside transactions go more smoothly and reduce double parking. I'm making temporary retail pickup and drop-off zones available for businesses and commercial areas. Through this program, retail businesses, including shops, restaurants, and other food establishments, along with business districts throughout the city, may request temporary pickup and drop-off zone for use by customers and delivery drivers. These zones will enable residents to quickly and safely pick up purchases while ensuring frequent parking turnover so the location remain reliable, available for use. Details of this program may be found at parking.baltimorecity.gov. Next, while gyms and fitness centers must remain closed, starting tomorrow, we are permitting outside exercise classes for up to 10 individuals so long as social distancing and face covering rules are followed. Finally, I want you also to know that my administration is making plans for reopening when conditions allow. Per the governor's executive order, restaurants are still closed with the exception of providing carry-out and delivery. The governor's stage 2 reopening will likely include 25% maximum capacity inside restaurants. Once the governor moves to stage 2, I will reassess based on the advice of our public health professionals. Now, here's what we have been working on in preparation of reopening Baltimore City. First, I created a governance team for safely restoring city services and operation. This team is reviewing and prioritizing all city agencies' plans to restore city service that have been suspended. And they are making recommendations to me about how to safely bring back city employees to work so that we can increasingly resume more services while protecting the health and safety of our employees. Next, I've tasked the BDC and the Neighborhood Design Center to lead design for distancing, reopening Baltimore together. This is a tactical urban design initiative intended to help small businesses reopen without compromising public health. The effort will encompass selected districts across the city, including current and former main streets, retail business licensing district, and arts and entertainment districts. Identified as priority areas for Small Business Assistance Fund grant program. We'll launch a design RFP that seeks tactical concepts for innovative urban public space configuration for safe social distancing and patronizing businesses, using Johns Hopkins School of Public Health proposed guidelines. Through this initiative, we will create a digital pattern book containing the winning design along with additional resources. And this will be made free for download for anyone in the world to utilize. We will implement these public space reconfigurations in selected Baltimore City districts. Each district will be paired with a local design build team to scope, develop, and implement public space interventions in July. More information can be found at www.designfordistance.org. Next, I have also convened a restaurant task force. It will work under the COVID-19 Small Business Task Force, and it is made up of a diverse array of restaurateurs from across the city. They are tasked with reviewing guidelines and best practices for restaurants to follow once they begin to reopen and make recommendations to the mayor. We're also working on an outdoor seating relief program and outdoor dining street closure program. These efforts will enable our restaurant community to hit the ground running when Baltimore City reopens restaurants. We're developing a simple, streamlined process for restaurants to obtain permits to provide outdoor seating. This program shortens the approval process from 3 months to under a week for most restaurants, and developing a framework for restaurants and business districts to apply for road closures to improve social distancing while increasing access to restaurants and businesses. All fees associated with outdoor seating application and license will either be waived or rebated depending on the fee. This reduces additional financial burden on restaurants that are just trying to survive. The city will reimburse all fees waived or rebated through the Federal CARES Act. Today, we are joined by the chairs of our COVID-19 Small Business Task Force, Councilman Eric Costello, and interim president of the Downtown Partnership, Shalonda Stokes. And now I ask them to come up and share more about our plans for Baltimore business community.
Thank you, Mayor Young, for your leadership and also for your insight in the creation of the COVID-19 Small Business Recovery Task Force. As you announced on April 22nd, this public-private partnership was formed with support of Baltimore Development Corporation to really help figure out how we could take the guidelines, pull in best practices, and streamline for when this recovery and reopening happens. All of us are impacted in different ways, and the great thing about this committee and this group of people is that the diversity of this group helps us bring in best practices. And so we're meeting every 2 weeks. The information is available on the mayor's website. The meetings are open, and so people can attend and look at that. And part of what the mayor announced today is an addition and a fallout of that. We know that restaurants are greatly impacted, and so the Small Business Committee is an addition. And we also know that tourism is impacted, and so this group is really focusing on those areas that are hardest hit. In addition to the task force itself, there is a fund that the mayor has, and I know Councilman Costello can give us a little bit more on that, but I'm available for questions after. Thank you.
Mayor Young, I want to thank you for your extraordinary leadership throughout this pandemic. As the mayor mentioned, we've set up 2 additional programs. One is an outdoor seating relief program that will cut down the process time from over 3 months in many cases to as little as 72 hours. We know that our small business community does not have the ability to wait 3 months to be able to get back close to the revenue that they were capturing prior to COVID-19. In addition, those fees will be waived or rebated depending on the specific fee to ensure that Baltimore city government is able to recoup those fees through reimbursement through the Federal CARES Act. In addition to that, there's the outdoor dining street closure program. That's going to be targeting small streets, non-arterial roads that do not have public transportation on them, in residential areas that have a high density of restaurants. So we're looking forward to both of those programs. And again, thank you, Mayor Young.
Thank both of you for your hard work at this challenging time. Now we will take a few questions. Oh, Colin. Oh, I'm sorry, Colin, did you want to say anything? Come on up.
Thank you, Mr. Mayor. Colin Tarbert with Baltimore Development Corporation. The mayor actually touched on the program, but I'll just give you a few more details. With the mayor's support, we're launching on this Friday a $1.5 million program called Design for Distancing, and you can find the information at www.designfordistancing.org. And this is a partnership with the Neighborhood Design Center, a local nonprofit design group that works with communities, as well as a partnership with the Johns Hopkins Bloomberg School of Public Health, which is providing the public health expertise. And this will be used to readapt a lot of the public space in our main streets and commercial districts, as the mayor said, to make it easier and safer for businesses to reopen. I know our small businesses are certainly hurting and want to reopen, but we all want to do it safely. And so we're very excited to announce that this Friday on May 29th, there will be a request for proposals on the website for design teams and designers to participate in the pattern book that the mayor mentioned. And those responses will be due on June 7th. And then we'll be taking those designs and adapting them to various districts throughout the city. And we hope to implement those, as the mayor said, in early July. So I'm available for questions as well. So thank you, Mr. Mayor.
Thank you, Colin. Now we'll take a few questions.
For the retail curbside pickup, can you only do that if you get one of the zones through the city, or are all retail stores able to open?
Well, it's really in the commercial districts, am I correct with that? Commercial districts like Canton and places like that. Cheryl, you want to come and talk to that? Well, what we want to do is, the surrounding counties are doing curbside for their retail businesses, and it's putting our business at a disadvantage. So I'll let Cheryl come up and elaborate a little more on that.
So we are making curbside pickup available for all of our small retailers, but we, because we know that there's concentrations and also traffic issues, if there is a cluster or certain stores that want to apply to have a curbside pickup zone, we're making that an available option as well. So it's just another way to make it easier for customers and businesses to resume those types of operations safely.
Thank you, Cheryl.
Mayor, the design plan, et cetera, I mean, is the goal here to essentially close streets for the purpose of allowing restaurants and other businesses to operate as much as they can outside? So we could have commercial areas where we now have traffic, and when this all goes into effect, they will be closed to traffic so that businesses can operate, restaurants, et cetera, can operate outside.
Yeah, that's what they're working on now. Who wanted to speak to that? You want to speak to that, Ari? Because right now, we want to make sure that there's community input and community support as well. We're not just going to blanket do that.
Thank you, Mr. Mayor. So all of these things are complementary to each other, the design for distancing, the outdoor seating relief program, and the outdoor dining street closure program. The thought behind the outdoor dining street closure piece of this is that in certain neighborhoods that are residential, you may have small streets that could be shut down to traffic because they're non-arterial roads. They do not have public transportation routes currently on them, and you could create a shared outdoor area for patrons of those businesses, specifically restaurants, to utilize together. As the mayor alluded to, it's critically important that we have business support from the business community, but more importantly that we have support from the residential community. So that's all baked into the process when neighborhoods come forward to apply for it.
Thank you, Councilman.
Mr. Mayor, sticking to the same subject, there are some restaurant owners, particularly in Little Italy. They're saying they appreciate.
You say where?
Little Italy.
Mm-hmm.
They say, for the most part, they appreciate the effort, but it's not happening fast enough. How do you respond to that?
Well, number one, the governor haven't given us really any direction on opening up restaurants. In this order, they are still closed. So at least we're trying to do something.
Right, and if I may follow up, sir, this, I don't know whether you're going to speak to it or the commissioner, but this is in reference to the shootings that happened over the weekend, the holiday weekend. In particular, we talked to the sister and elderly mother of a 60-year-old man killed Friday. They say he was shot and killed in retaliation. Someone was trying to get back at his oldest son. Where are we in that investigation, and what do you have to say to that family?
Well, personally, I offer my condolence. And like I said before, having lost 3 nephews to gun violence in the city of Baltimore and a cousin just 3 months ago, I'm appalled and I'm also angry about the level of violence that's going on in the city of Baltimore. While we even before the pandemic, now during the pandemic, it's gotten a little worse with these shootings and killings. And I know the commissioner is working hard. I'm going to let him come up here and talk about it. But this level of violence is totally unacceptable. And like I said repeatedly, I can't do it by myself. The council can't do it by itself. The commissioner and the police department can't do it by itself. We need our community partners and our communities to come and step up to the plate and give us information because they know firsthand who's doing this. Mr. Commissioner.
Thank you, Mr. Mayor.
Thank you, Mr. Mayor. And certainly we offer our condolences as well. we know that several of the incidents over the weekend were acts of retaliation from previous bad acts. Number two, most, if not many, if not most of these were between people who know one another. And at the core of it all are guns. And so we're working to make sure we get to the core of it all to talk about having the swiftness and the certainty of punishment and consequences, which sometimes doesn't exist. That's why people do this. The swiftness and certainty of punishment and consequences to go after people who are illegally carrying guns. Three, if not four of the victims who died this weekend had a gun on them when we arrived. And we are working to get at that to make sure we can change this culture. There are many things that drive this culture.
Yes,
That's
sir.
at the core of
And
it.
speaking to Stephen Clark, that case, the 60-year-old man, where are we in that investigation?
That's
I know it's early.
a fairly new and still open investigation. As a matter of fact, we just wrapped up a call with all of our federal and state partners of all the state and federal law enforcement agencies, and we talked about this weekend's violence and how it's connected to other cases that are being worked, and to make sure we all stay focused and to not lose sight of the old cases, but to still focus on the new ones as well. So it's an open investigation. Our detectives are working around the clock. What we need is, like the mayor said, the people who know something, heard something, and saw something to step forward. Earlier this year, we had some success with that, and now we need it again.